Test your pediatric nursing knowledge with these NCLEX-style questions, perfect for exam prep and clinical confidence. Let's get started. Which vaccine is given at birth? Answer: hepatitis B. What is the most common cause of dehydration in infants? Answer: diarrhea. At what age does the posterior fontanelle close? Answer: 2 months. What is a priority nursing action for a child with epiglottitis? Answer: do not inspect the throat. Which condition causes a seal-like barking cough? Answer: croup. Which sign indicates respiratory distress in a child? Answer: nasal flaring. What is the recommended site for IM injections in infants? Answer: vastus lateralis. What condition is screened for at birth using the Guthrie test? Answer: phenylketonuria. What is the expected heart rate for a newborn? Answer: 120-160 BPM. Which toy is most appropriate for a 2-year-old? Answer: push-pull toy. What is a common symptom of otitis media? Answer: ear pulling. What is the first solid food introduced to infants? Answer: iron-fortified cereal. Which condition is characterized by wheezing and difficulty breathing? Answer: asthma. Which developmental milestone is expected at 6 months? Answer: sits with support. What is a sign of increased intracranial pressure in infants? Answer: bulging fontanelle. Which disorder requires avoiding gluten in the diet? Answer: celiac disease. What is the most appropriate pain scale for a 3-year-old? Answer: FLE. What is the treatment for Kawasaki disease? Answer: IV immunoglobulin. What condition is associated with a positive Ortolani sign? Answer: hip dysplasia. What is the most common pediatric cancer? Answer: leukemia. What age group is most at risk for iron deficiency anemia? Answer: toddlers. What is the first priority in treating a febrile seizure? Answer: ensure airway patency. What is the incubation period for chickenpox? Answer: 10-21 days. What is the hallmark sign of intussusception? Answer: current jelly stools. What is the most common cause of bronchiolitis? Answer: RSV. Which food should be avoided to prevent botulism in infants? Answer: honey. What age can a child start receiving the MMR vaccine? Answer: 12 months. Which sign indicates dehydration in a child? Answer: sunken eyes. What is a normal respiratory rate for a toddler? Answer: 20-30 breaths per minute. Which condition requires contact precautions? Answer: RSV. Which organ is affected by cystic fibrosis? Answer: lungs. What is the primary treatment for hydrocephalus? Answer: VP shunt. What is the primary concern in a child with nephrotic syndrome? Answer: protein loss. Which vaccine is contraindicated in pregnancy? Answer: MSR. What is the most accurate method to measure temperature in infants? Answer: Recta. What is a key characteristic of autism spectrum disorder? Answer: impaired social interaction. What is the antidote for acetaminophen overdose in children? Answer: N-acetylcysteine. Which lab value is elevated in rheumatic fever? Answer: azotiter. Which condition causes a high-pitched cry in infants? Answer: increased ICP. What is a sign of measles? Answer: Koplik spots. What is a normal hemoglobin level for a child? Answer: 1113 G/DL. What is the best way to prevent SIDS? Answer: place infant on back to sleep. Which childhood illness causes swollen parotid glands? Answer: mumps. What is the typical age range for toilet training readiness? Answer: 18 to 36 months. What is the best indicator of pain in a nonverbal child? Answer: behavioral cues. Which type of fracture is suspicious for child abuse? Answer: spiral fracture. What is the leading cause of death in adolescents? Answer: accidents. What is the priority in a child with suspected meningitis? Answer: initiate isolation. What is the most common complication of strep throat? Answer: rheumatic fever. Which reflex disappears by 4 months? Answer: Moro reflex. Well done, everyone! If you enjoyed this quiz, don't forget to like, subscribe, and hit the bell for more fun challenges. Thanks for playing, and we'll see you in the next quiz.